His Majesty told the school principal that the medical supply was meant for the community too, in case someone might need and come for medication. That's what he said. The supply was provided to meet the school's basic medical needs.
Decades ago, our country was plagued by multiple public health problems. Besides, communicable diseases and bad cases of epidemics occurred. Today, these problems are behind us. Aside from feeling grateful for the uncountable instances of help His Majesty had rendered us, how His Majesty tackled the problems is worth studying.
It was one of the times when the hospital at Gawila Army Camp had to handle an unusually vast crowd of patients who came for treatment by the Royal Medical Team accompanying Her Majesty the Queen on a free-of-charge basis. Over 50 years ago, at the time when His Majesty the King began his visits to people living in remote areas, the royal visits used to entail a team of medical doctors who were assigned to tend to the royal family and members of the royal entourage only. However, the sights of sickness among his subjects caused His Majesty to command that the royal physicians extend their services to his people as well.
So many people turned out, His Majesty stressed that anyone with an illness was to come for treatment. Whenever he came, he had a team of royal physicians with him.
With an ever-growing number of sick people who came to meet His Majesty, the Royal Medical Unit was initiated, providing them with general practitioners as well as doctors in various fields of specialization. A good number of those who were critically ill or disabled were registered as patients under the royal patronage.
Some of the hills were out of bounds to common people because danger was too great. Besides, they suffered a lot for lack of doctors up there. That's why His Majesty established the Royal Medical Unit that went by helicopter to treat those people.
His Majesty reportedly gave analysis that the root cause of most poor people's sickness was lack of knowledge regarding public health, ranging from nutrition to first aid. Hospitals or health stations were also lacking. The training program for village medical volunteers was launched as a result.